that then brings us to the next stage of our program today. Jane, I reached out to Jane last week about, was there somebody that we could she could maybe point us toward locally here at our local hospital that might be able to address what the state of the union is for Thomasville and Davidson County, because the hospitals are all over the country and the world, for that matter, are obviously stressed to the max right now. And she brought Heather Ridge up for us to maybe contact, and Heather's going to be our program speaker today. And so we reached out to her. Her background: she grew up in Davidson County. On her bio, she's lived here most of her life. She lives in the Oak Grove School District with her husband of 20 years and 3 kids. Bless your heart too. And she currently works as the infection preventionist at Thomasville Medical Center. She's in the past worked with Carolina's Healthcare and been a consultant for the North Carolina statewide program for infection control. She's worked in several different healthcare settings: acute care, oncology, skilled nursing, and hospice. And I know that she's got her hands totally full right now with probably the biggest infection control risk that she's ever faced, if I had to guess. That dreaded worldwide pandemic is indeed upon us. That she is probably she's probably on the forefront on that. So I'm going to introduce y'all to Heather Ridge from Thomasville Medical Center. Hey, Heather, thank you for joining us today.
Hey, thanks for having me. Good to be here and hear about all the good work that you guys are doing. Yeah, so I've been in infection prevention for a while, and I've kind of blocked out the H1N1 crisis back in the late 2000s. Ebola, let's just not even talk about it, but this is a whole new ballgame. It's just a whole new world out there. Here we are with a true pandemic, started across the world and got to us on the back end of it, and it's been a real challenge. It's been very fun to watch the community and healthcare here step up together, because it's all about doing it together, because we can't do this by ourselves, and we have to have everybody's commitment. So I just wanted to just kind of talk about I like data. I'm in healthcare, I'm a nurse, I'm data, but I love a couple of great websites with great resources, because right now with the news, there's so much information on the news, you almost can't get away from all things COVID. It's important that we do check out from time to time, because we need a break. But also be very mindful about what information you're hearing and the source of truth. So, CDC, the Centers for Disease Control, the World Health Organization, our public health webpage for North Carolina, also in our even local health department, those are true sources of truth. So be mindful of where you get your information from. So as of this morning, 11 a.m., North Carolina has 7,220 confirmed cases with 242 confirmed deaths. Here in Davidson County at the same time period, we have 103 confirmed cases with 2 deaths. Now keep in mind, up until recently, testing parameters changed. Back in the very beginning, we had limited testing capability. We had really long turnaround times, which was a very unfortunate thing across the country. And we were only testing certain people who met criteria. So there were a lot of people in the community who may have had symptoms. They were either told don't come out, just stay home and quarantine, reach out if you had symptoms and needed to go to the hospital, but basically just stay home and quarantine unless you needed health care. So we have a lot of unconfirmed cases out there. So be very mindful of across all the data across the world. If there's not testing there, there's going to be cases that are not accounted for. So the number is higher. You talk a lot too about comparing it, you hear it compared to flu a lot. So here's another interesting little tidbit. So if I just told you that North Carolina had 242 deaths during, as of right now, in our flu season for North Carolina, which we start in 2019 and go through 2020, as of September 29th, we've had 167 deaths in North Carolina related to flu. So COVID in a couple months has exceeded that here. So, the flu is not as transmissible. We've learned that COVID we can share it and spread it more easily. Not as easy as measles, but we're passing along. So it's serious, and we don't have a vaccine. That's another big thing. We have this new virus. We've seen it rear its head as SARS back in the early 2000s. We hear of Middle East Respiratory Syndrome, MERS, over in other countries, Iran and those areas. And it pops up from time to time, but it's very short-lived and very small, controlled. But with the new virus, there's so much to learn. We're learning new things, daily. So much. And there's limited studies out there because it hasn't been around, it's only been around since November. So we don't have all the answers, which frustrates a lot of people, and everybody's just doing the best that they can and relying on the facts that we know as of today. And it could change in 2 minutes from now. So we just have to be patient, which is hard. So again, this is a new virus. We know that it spreads via respiratory droplets. So cough, sneeze, talks, and sings. So even breathing the air of someone who is sick could make you sick, which is scary. We also have situations where we feel like there's probably asymptomatic folks out in the community who could potentially be spreading the virus. We don't have a vaccine. That's what makes this very, very much different from the H1N1 back in the late 2000s, because we had flu, we've had flu vaccines rapidly developed, and this is going to take a while to get a vaccine developed. So unfortunately, until we get that, we're going to still have at risk. So things that we can do, really, it's transmitted person to person, usually within 6 feet. So spatial separation, that's a big one. Taking those 6 feet apart, not hanging out in groups of greater than 10 people, listening to your guidance. We've been told to really do essential work. If you're doing essential work from home when you can, if you've got the opportunity to. When you go out in public, be mindful of who you're around. Whew, I tell you right now, I get nervous in the grocery store and Lowe's and Walmart. You go by them, and they're really busy. It almost looks like Christmas time shopping out there. So you wonder, how are people being safe? And we see protests on the news, and people are stacked together, and they're not practicing that 6-foot rule. CDC also advised that when they're in public to cover your mouth and nose. There's lots of different patterns. It can be very simple. You can take an old T-shirt and cut it so you don't have to sew, because I myself am not a sewer. And there's, you can get really fancy with your mask. But, basically, if everybody was to wear something over their mouth and nose, then we would keep our germs inside, and we wouldn't spread our germs to other people. And that would be a nice safety thing. It's also avoiding touching your hands to your face and your mouth and your nose, which that's challenging, especially with glasses and having your hair down and having a mask on. You want to touch your face even more. So, trying to be mindful of those. They say on average, you touch your face over 20 times. It's just crazy how much we touch our faces. Also, too, just be mindful. Again, there's a lot of folks that are out in public and they're wearing face protection that could be the N95 respirators that are more designed for healthcare. So just to be mindful that we really are trying to conserve that critical PPE, personal protective equipment for the healthcare frontline workers. So just be mindful of those things. Watch for symptoms. So again, you hear a lot of other random symptoms, but most symptoms appear within the 2 to 14 days. It's the fever, the cough, the shortness of breath, or difficulty breathing. And that's the scary one for a lot of people. You might have a fever and cough, but when you start having problems breathing, that's the real tricky part, where you need to come to the hospital or talk to your doctor before you come to the hospital. Chills, fevers, muscle, headache, sore throat. Another interesting tidbit that people are saying, they lose their taste and smell, which is a very interesting phenomenon. So warning signs when you do need to call and get medical attention, trouble breathing, persistent pain or pressure in the chest, just bluish, coloration issues. But we want you to know that you call your doctor, do those televisits, talk to them, get guidance before you come in. They may want to take you to a testing center, which decreases the risk of contact with a lot of people. Or they may say, if you're going to go into the emergency room, call ahead if you're suspected at COVID, or tell them immediately so you can mask. Because everybody just wants to help keep us all safe, because it's a community. It's widespread in North Carolina. It's walking around at a neighbor near you. So we just have to be careful of that. So what we're seeing from the current data, there are some high-risk groups out there that are associated. People 65 years and older, that's of course one. We know that folks living in long-term care facilities and nursing homes are very, very vulnerable and high risk. They've done a lot of limitations on visitors and restrictions and screening of team members, because once you get something that's hard if you don't have all of your isolation practices in place, if it gets through a vulnerable population like that, the outcomes can be really severe and unfortunate, as we witnessed in Washington State with their first outbreak in the nursing home. People with chronic lung diseases, specifically asthma is another big one, serious heart conditions, and folks who are immunocompromised in general, that have maybe they're on chemotherapy or on suppression drugs, they puts them at a greater risk. There are also some people, they're having associations with people who have a body mass index greater than 40. So obesity is playing a role, and we didn't see this at first. Now that we're seeing it more as it's coming into the United States, we're seeing those kinds of cases and outcomes that are poor. Diabetes, chronic kidney disease and dialysis, and folks with liver disease. Now, some other populations, pregnant people. We don't know enough about the risk to pregnancy and the babies and that kind of things. This virus is unusual that we're not having as many bad outcomes in children and young people, young children, which is very different, because flu is an equal opportunity organism and it goes after older and the younger. But this one's been a little bit different, which has been helpful, but they can still spread it, because that's what little kids do sometimes. So now, with all this going on and how we can keep ourselves protected and safe, again, we've got a good news that we've had is we have testing. We have more testing supplies. So now the state and the health departments are looking forward to having more data to work with, to really follow this like we follow influenza every year, to find out, what is our asymptomatic patients? What are our true confirms? Who's cleared? Who's better? Those kinds of things. But I think what we need to remember most of all is we are in this together, and it's going to take all of us. You hear a lot on the news where they talk about flattening the curve. That's exactly what we've been doing. It's not meaning that it's going away. Flattening the curve means we're not having any increasing cases or decreasing cases. It's truly a flat line. The longer the flattening is, it does extend the situation, but however, it creates us having a huge peak. The huge peak we saw happen in New York. They had overcapacity and influx of patients who overwhelmed their healthcare system. And that's what we don't want to happen. We don't want to happen here, because if we can't safely take care of the patients and keep our team members safe in the hospital, we can't take care of anybody. So it's very important that we all do this together. I think we've done some really good things at Novant. We've been on this. We had a new emerging infectious disease policy that we rolled out at the end of last year. As Chuck says, getting the dust off of the old policies and practices that were in place. We had already started throughout the system having influx and tabletop emerging infectious disease outbreak. It was really kind of very interesting that here we are. We had one at Thomasville the week before we had our first potential case come in the doors. So we'd already started practicing and planning for influx, which was good, which was great. We got the Infection Prevention Command phone open for resources and questions. We have our internal internet or intranet that we call it our Novant source of truth. All of our information, things that we need to do, best practices, training, education, scripting, any kind of resources, you name it, it's on our website, and every team member has access to it. So we can always know what's the truth and what do I need to do to safely take care of my patients and also to keep myself safe. Because again, our goal is to keep our team members safe so they can take care of our patients who need us the most. And that's really important. We have weekly calls with our Carl Amato, our CEO and president. We have all the executive leaders from human resources, our epidemiologists, to supply chain for our resources. We are very fortunate that we have the supplies we need to take care of our patients and keep us safe. So I'm very grateful for that. And I'm grateful that we have team members who are engaged, who are wanting to do what's right. So thank you. Do you have any questions or comments or anything specific you want to ask me about?
I do. I have a question.
Okay.
and I don't know, I don't want it to be an unfair question. If you can't answer it, that's fine. But
Okay.
we've heard some cases where one spouse could get the virus and the other does not. So my question is it possible for some people to be immune to the virus? Is that even, now I'm not a medical doctor, so I don't know what I'm talking about, but but is that possible?
Honestly, we don't know. There's so much unknown. And it could be, if we didn't test that spouse, were they positive but asymptomatic? Until we increase our testing in the community and get serology testing to look back to see if people developed antibodies to it, we won't be able to answer that question.
Okay. And I've also heard, and I'm not going to ask you any more questions.
You can ask away.
That people are asking people or telling people to get the flu shot. Would the flu shot have anything to do with this virus? I mean,
no, it will not. The flu shot will not protect you from coronavirus or COVID-19. However, we were seeing a lot of flu still circulating in the very beginning of this. So any preventive measure so you don't get a double whammy or have another illness is still good to do.
Thank you so much.
No, great questions. They're great. Thank you. Okay. I don't know the answer to that one. I haven't talked to my health department colleagues in a while, and they haven't mentioned any hot spots to me. In particular, like if it was a business or an area or community, I haven't seen any trends by cases that I've come across. So I don't know for sure on that one.
Chuck, you're muted. Thank you. Okay. Oopsie. So I've got a friend that works at Moses Cone, and she was telling me yesterday that over there that they're like allocating nurses and the workers in the hospital like one respirator to wear a week, and they're having to try to figure out ways to disinfect them between uses and reuse them over and over. What are you guys doing at Thomasville? What have y'all found is the most effective way to, I guess, make your limited supply of protective devices sustainable or reusable? What's y'all's best practice?
Yeah, so you're going to see and hear lots of innovative ideas to prolong things that are in limited supply. I mean, the fact that we're in healthcare and we're extended the use of items, it goes against everything your norms. So right now we don't have issues with getting N95. We do have some extended use times, but they don't extend to that extent. There have been some ways that you can disinfect. It's not a sterilization process, but disinfect using accelerated hydrogen peroxide. Duke did some testing and experimentation with that method and process, and that is something that we have available if the need arises to reprocess masks, but we're not there where we need to do that right now.
Okay. And one other follow-up question to that: have you found that the 6 foot rule, that would be like for like sneezing or droplet precaution, but is that coronavirus and is it more like a droplet short distance, or is it more like an airborne, like measles or influenza being an airborne type virus that if you're in the room with somebody, you'll potentially get it?
So that's been the interesting piece of this journey. You know, right now we follow contact and droplet precautions unless it's an aerosolizing procedure, and that list can become quite extensive. And then that would require the use of a PAPR hood or an N95 respirator mask. So folks on BiPAP and CPAP, and if you were doing nebulizer treatments, there would be brief periods where it could remain in the air. So there have been a lot of innovative ideas related to that. I will say one of our really great strategies with our plant engineering, Ben here, who's phenomenal, we've converted a large majority of our patient rooms into negative pressure. So that we have a HEPA filter. We pull all the air inside the room is exhausted through a filter and into the air where it would quickly die. So that's one safety measure that we have done for any potential COVID patient to protect them. And then that way it also purges the room air quicker. So we don't have to wear an N95 for only a set amount of time if you're doing something intermittent. So there's different strategies in places and lots of different innovative ideas that are being trialed out there, which is what we just have to do to be mindful and to conserve our PPE, because that is, again, we want to use it when we need it and have it when we have to have it.
Okay. Thank you, Heather.
You're welcome.
Heather, has there been any further research as to after death, how long this virus is viable?
After death, I think the latest, and don't quote me on this one, I feel like that the latest guidance for postmortem care, I know for culturing from the state, was up to 72 hours after the death. And North Carolina did release some postmortem. Again, I can't speak to it off the top of my head. I've got so much information in my head, I have to go to my source of truth to double check. But I do believe the culturing is up to 72 hours. So, yes. Right. That's a good question. I mean, if there was a person that you saw more who knew your health history more and more current, then I would reach out to them because if you've got those comorbidities, I think your pulmonologist would be good, or your oncologist, your specialty doctor. But really, your family medical doctor could help guide you, because they can do, a lot of our physicians, providers are doing telehealth screens where you can just get on your computer or phone and have a virtual visit, which eliminates that need to come in. But if they do need to send you in for an assessment, they can do that, or send you to a testing site so you don't actually have to, you could just go to a one-stop shop. It's actually the drive-through clinics is quite unique in that manner. But I think, if you were under specific care, I would go to that person that you're working with more closely, who's been seeing you more recently. But any of your providers should be able to help direct you.
Hey, Chris, it's Carol. We've had that issue, unfortunately, and we actually called the oncologist. They sent us directly back to our family physician by phone, and they set up at a clinic. They didn't send us to a hospital. They refused, that whole thing. And for us, we were refused any treatment by anybody else except our family physician.
Yeah. Well, thanks for sharing that info. Thank you.
I have a question.
Okay.
Go ahead.
Okay. Yesterday, Winston-Salem, in connection with Novant and Wake Forest Baptist Medical Center, announced that they were providing masks to every citizen of Winston-Salem. And they're doing that, and those masks have been manufactured in Mount Airy and have been delivered to Winston-Salem. Is our mask that effective that maybe that's something we should consider for Thomasville, if the way be clear to make those available to every citizen? Would that even be feasible?
Well, that's wonderful. I had not heard about that specific news from Forsyth. I know as a system, we've been having this conversation for a while and working with different local manufacturers, trying to help support our community and our healthcare systems. Honestly, if people were to wear the mask, a cloth mask, not the hospital grade, but just a cloth mask, it would help keep your secretions inside to help spread them outside. So I think it is a barrier. It's still, we need to do our spatial 6-foot rule, but it would definitely, I think it should help. It would help if we did something. That would be a great initiative. But I do know that we at Novant are looking into trying to have that. We've just, you're just working with different manufacturer companies, and you've got to have it come together before we can do something like that. That's awesome for Forsyth, but it could be a nice benefit for everyone.
But Heather and Jenny, I heard this morning about those masks on the news, but what they said was they were going to be available at Lowe's for $2.50.
Oh, okay.
You're handing out free to everybody.
Gotcha. Okay.
And you've got to go somewhere to get them.
Okay. I'll have to follow up on that because I had not heard that for that area. Thank you for sharing that.
I have a question also. I have an actual question, and that is, I was a nurse at Thomasville for 20 years, and I retired after 9 more at the Forsyth area. So have you had COVID patients at Thomasville? My question is, I know you were saying you have the negative flow rooms for them. So have you had those, or is Novant having an area, say at Forsyth or at Kernersville or at somewhere that they're actually having having COVID units as opposed to having them spread out along in the different areas? Oh,
I hear. Yeah. So our plan is that for the larger healthcare facilities like Presbyterian and Forsyth, that would be our dedicated COVID units for those patients. The only time we would keep positive patients in our community or other settings would be if it was someone where by the time we got the result, we were anticipating a short discharge time. So it might be very quickly. But yes, we are truly cohorting and directing them to certain facilities where they can have dedicated staff and units. Yeah.
Would masks be a possible project for the club?
That depends, Don. Do you sew?
A little. Actually, I find that staples work real well in making things like masks. For us that don't sew.
CDC has some templates. And there's some of the templates are taking old T-shirts that you don't even have to sew at all, and that's more my speed. You can actually cut them and do the ties.
I have a suggestion as well. As I saw somebody on Facebook take a pair of socks.
That's it.
And cut them on the ends, cut them a little bit so you can put them behind your ears and put a piece of paper between it. And she was trying to blow out a candle to show that nothing was getting through. And so obviously the socks, can be washed again too. You just take the paper out, throw it away. So I made 2, I should go get them and show you. I made 2 masks with socks, and it covered my nose and my mouth. I mean, is that effective, you think?
Yeah. That's awesome. That's awesome. That's wonderful. Yes.
Well, I happen to know that the ones that are being made available in Forsyth County and Winston-Salem are being manufactured in Mount Airy from Spencer Manufacturing. So they're local, and we all want to support local businesses.
Mm-hmm. Love it. Love it. I've seen some really good things out there.
Other questions for Heather?
Heather, do you think some of us could have been exposed back in November and December with this and just didn't know it was COVID?
Until we start having serology tests, we just won't know. Because, could we have potentially, and I've heard people say that, but really, I feel like we would have been hit a little bit harder sooner because it is the spread, the outcome. But we won't, again, we just don't know. We just don't know because we know that travel occurred. But I hate that answer of I don't know. We all like to know all the stuff going on, but we're in that uncertainty phase.
Heather, what can we do as the Rotary Club? Do you have any ideas of what things we could do to support you, y'all guys on the front line at Thomasville Medical Center?
Well, I think information sharing and modeling and having that community approach. I love that you guys are feeding folks who need it. I love the idea about the mask. I think that would be wonderful, but just spreading the truth and helping eliminate the misinformation. And it really saddened me to hear about the hospice nurses, but I have had my team members, other team members in different disciplines share about nurses really being almost harassed in public. And that's so sad. These people are coming to work every day, putting their lives on the line, and the community is scared and they're lashing out against them. So help spread the support. They wear PPE when they're here. They clean their uniforms. They do all the good things. Oh, I have something good. A good one for public. Gloves. Gloves out shopping. I've seen there's a lot of stuff on Facebook where people are just wearing gloves all the time. Gloves give you a false sense of security. They really do, because I've seen people at the grocery store, they get out of their car with their gloves, they do all their grocery shopping with their gloves, then they reach into their purse or their pocket, they get their phone out, they get their wallet out, they get their money out, they put it back into their bag, their purse, and they continue wearing the gloves and go back to their car. All they have done, rather than cleaning their hands or using alcohol-based hand rub or something in the middle, they have taken every germ that they have picked up for their whole trip and deposit it right back where they're going to sit with all their things. So be mindful of helping people with that information. Gloves protect you, but not if you keep using them over and over. That's why in healthcare we say, clean your hands, put on your gloves, do your task, take them off, clean your hands. Because if not, you're just transmitting germs everywhere. And that's a big one.
What about washing the gloves?
Oh, not well. I don't know if I want to answer that, because again, from a nurse and healthcare systems, we would never say wash any gloves, but there are some gloves, work gloves, you might do it. But I think really just washing your hands or using hand sanitizer is your best bet. Hand sanitizer is awesome. Has alcohol content, make sure it's over 60% per CDC, and it has alcohol, which immediately kills those germs that you pick up from touching things. So that would be your best bet, or good old friction hand washing with soap and water for 20 seconds. That's truly the key, and that's much better practice than wearing gloves all throughout. And you're just putting yourself at a greater risk.
Any other questions for Heather today? We're about to run to the end of our show.
This is Carol again. I just wanted to say, Heather, I really enjoyed and appreciated your presentation a lot. I also enjoyed or appreciated being able to do the one with Douglas Erland yesterday from Public Health through Rotary. That was a statewide thing, and Rotary allowed us to do that, and I thought that was also helpful.
Thank you for that. Any final questions for Heather before we start to wrap up? Well, Heather, thank you again so much for sharing your wisdom and expertise and the truth about what you know. And we really do appreciate all that you do there, in trying to help keep our healthcare workers safe. And we may, if I could be so bold as to maybe talk to you possibly about reaching back out to you again at some point in several months for a follow-up on this, on how going forward down the road. My understanding is that this will be with us from now on, just like influenza is. And so hopefully in 3, 4, 5 months from now, we're going to be a lot wiser and have a lot more science and data back on the next time this circles back around us again. Maybe there'll be new information you could share with us on how to keep safe and what to do if we're exposed.
Absolutely. Thanks so much for having me today. I've enjoyed everybody, and especially seeing everybody sitting at plane yards and outside with the birds. It's very nice. So thanks, everyone.
And thank you.
Thank you, Heather.
Lastly, right before we wrap up, I had a reminder here to ask 2 people. Roger Bryant has been our general in charge and commander of the phone book delivery. Roger, any final updates on the delivery, how it went, when the club will expect to get rewarded for all of our labor, any accolades you could share?
Can you hear me? Number one.
Yes.
Okay. My last conversation with the representative from North State, he indicated that he would go to the office Tuesday and order the check. So I expect maybe the end of the week, maybe first of next week, we ought to get our checks. And I've told him to pick up the trailers. So Harold will get them off your property pretty quickly. And good job them all those that did it. Thank you so much.
Okay, and thank you, Roger, for taking that bull by the horns, and all of the people that participated in body and in spirit to help get that project off the ground and completed in such a rapid fashion. I think that was a job well done. Thank you all. And then finally, we've got Mayor York on the line here. Hey, Raleigh, do you have any updates as far as the city's perspective? Anything that you could share with us on what we could do to help you? Or
well, we're just trying to keep pushing information out. We've done some videos that have gone over the social course of things, through the Facebook and our website and so forth. And just like Heather said, follow all the guidelines that we've heard many, many times, and that's what we're doing. We're so thankful in the city that we have not had any of our employees infected with the virus. We've had a few that have had to be tested for one reason or another, but no positives there. We're thankful for that. We continue to provide all of our services to our citizens, like we did, with the exception of those that bring groups together. Most of these are through the recreation department. So most of the other things you should see carrying on as normal. Just be safe out there and take all precautions. We're gonna get through this. We just don't know when. But it's good to see everybody. Good to see you all in good health, and just keep up the good work.
Thank you, Mayor. We appreciate all that you're doing behind the scenes to help keep us safe. So we appreciate you and all of your staff and the city.